The American Medical Association may reverse their stance on assisted suicide and take a neutral position on the life-ending practice. The AMA meets tomorrow to discuss revisions to its assisted suicide policies. One resolution proposes to stop, quote, criminalizing doctors who perform assisted suicide and calls for the term to be replaced with medical aid in dying instead. Physician-assisted suicide is when a doctor facilitates a patient's death. The Catholic Church teaches life must be defended from conception until natural death. That assisted suicide is intrinsically evil. In the past, the AMA firmly opposed the practice. Joining us now is Dr. Jeff White, a practicing cardiologist who has been a 45-year member of the AMA and will be one of the group of doctors testifying against these assisted suicide changes at tomorrow's meeting. Dr. White, thanks so much for coming on. We appreciate it. So is this a 180 for the AMA, and what is at stake at tomorrow's meeting?
Well, thanks, Tracy. There is a lot at stake, and if these provisions were to be adopted, they would be a near complete 180 of the AMA's opposition, long-standing opposition to assisted suicide. If you go back to 1993, Dr. Jack Kevorkian had assisted the suicide of about 16 patients, and at that time, the American Medical Association adopted a policy that physician-assisted suicide is fundamentally incompatible with the role of a physician as healer. Now, in 30 years, the AMA has consistently, reliably, and reproducibly defended that opposition, most recently about 4 years ago by a supermajority vote of the delegates. This weekend, the committees of the AMA will consider two proposals, as you have outlined, one of which would remove operational opposition to assisted suicide and change the name to an ethically vague term in AMA policy. The other would flatly take the AMA to a position of neutrality on the issue.
Dr. White, I mean, how did this shift happen? Where is this pressure coming from, within the American Medical Association? And I thought, part of the Hippocratic Oath stated, do no harm.
Well, you are correct that the Hippocratic Oath says, and I swore it over 40 years ago, that I will give no deadly drug to a patient. In physician-assisted suicide, a patient who is in desperate straits, believes that they have come to the end of their rope, comes to a doctor and says, I would like to end my life. And rather than getting suicide prevention or counseling, enhanced social support or spiritual support, the doctor instead writes a prescription for a lethal, massive overdose of narcotics and sedatives, gives it to the patient with instructions on how to take it with the intent that the patient be made dead. That is clearly a violation of Hippocratic ethics that have stood well for our profession for over 2,000 years. The impetus for the AMA to reverse its position has come as a gradual number of states have legalized the practice, now 9 states and the District of Columbia. In almost every case in which that has happened, a state medical society has first gone to a neutral position, and then that has been seen as a green light to legalize the practice by legislators in those states. So it's very important that the AMA maintain opposition and not go to a neutral position on assisted suicide.
Dr. White, I want to ask you this before we run out of time. Advocates of physician-assisted suicide, they claim that this is death with dignity for loved ones who are physically suffering. What would you say to that?
Well, Tracy, if you look at the reports from Oregon and from Washington State, they ask patients, why did you want assisted suicide? Why did you ask for it? And almost 9 in 10 of those patients will say, I'm afraid I'll be a burden to my family. I'm afraid I won't be able to take care of my personal needs. I'm afraid I'll be a financial burden on my family. And only a small number of those, perhaps 25%, is the idea that I'm suffering uncontrollable pain an issue. So the advocates would say that this is death with dignity, but I really think, Tracy, that that message inherently says to others who fight through illnesses to their natural death, who bear suffering, that your death is not dignified. And I think that's a terrible message to send out to the patients that we care for. Physician-assisted suicide is not death with dignity. It is a tragedy and an abdication of medical ethics.
Well, Dr. Jeff, thank you so much for coming on and talking with us.
Thank
we
you.
really appreciate it. God bless you.
Thank you.